to repeal the ACA. With their lawsuit, the Trump administration and Texas-led Republican states have risked the health of children covered under Medicaid, seniors who rely on prescription drug discounts, young adults aged 26 or under who are covered by a parent's plan, employers who rely on tax credits to provide affordable health care, and millions more. We won't stand for this. Access to affordable, life-saving health care is on the line, and there's no clear distinction for voters and Democratic attorneys general on the side of the Supreme Court case defending health care, and Republican attorneys general are on the other side trying to take that health care away. Keep in mind that all 4 of the Republican AGs, incumbents running for re-election this year, are part of the GOP coalition in the ACA repeal case. Indiana, AG Curtis Hill; Missouri, AG Eric Schmidt; Utah, AG Sean Reyes; and West Virginia, AG Patrick Morrisey. And the Republican AG's candidates running for the open seat in Montana supports the repeal of ACA. It's hard to understand why during a global health crisis and with 20 million Americans unemployed, Republican AGs are continuing on this with this lawsuit, putting millions of Americans in danger of losing access to health care coverage. We know that Black and Brown Americans disproportionately benefit from the ACA. We must force the GOP to answer for why they are trying to take away health care from those communities at a time when they are disproportionately contracted and dying of the coronavirus. Not even a global health crisis has stopped the Republican AGs from wanting to eliminate health care and end protections for people with pre-existing conditions. But you know what has stopped the GOP? Electing Democratic AGs. So healthcare is consistently a top voting issue in battleground states. Voters consistently say they trust Democrats more on the issue of healthcare. And in 2018, Democrats flipped 4 AG states blue and running on a healthcare message. So now, to give a better look of what's happening in battleground states this year, let's meet the candidates. Great. So why don't you tell us a little bit about yourselves, introduce yourselves, and why you're running for AG. So let's start with our Montana candidate, Rafe Grable.
Thank you, Farrah. Can you hear me? We off mute? Great. Mute? Great. We're all learning Zoom some 100 days into the pandemic. I really appreciate you taking the time to meet with me today and to hear from us about really the stakes involved in this lawsuit and really what each of our states could stand to gain or to lose if it's successful. My name is Rafe Grable, and I'm the Democratic nominee in Montana. I'm a new dad, I'm a husband, I'm a son, and I'm, like many of you, I'm someone that relies on the success of our healthcare system. I've seen how it can have great personal successes through healing, and also how it can have great institutional failures, like the risk that this lawsuit presents. In my day job, I also work with Governor Steve Bullock here in Montana as his chief legal counsel, and I've helped lead our state's efforts to combat the spread of COVID-19. I'm running because Montanans need an attorney general who fights for them again. And I want to illustrate that with one little story that I think ties into this case really well. A few months ago, I met a woman in Havre, which is up in north central Montana. And she told me about how her daughter, who has diabetes, pays $2,400 a month for just one of her 3 medications that she needs to survive, to live a healthy life. Just one. Now that's wrong, but it's also the kind of problem that attorney generals can do something about. And I think it highlights the stakes of this case. If she's on Medicaid expansion, Montana is one of the many states that expanded Medicaid health coverage under the ACA. If she's on Medicaid expansion and this lawsuit is successful, her health insurance goes away and she becomes medically bankrupt. If she's on private insurance and this lawsuit is successful, she has a pre-existing condition and she lives at the whims of an insurance actuary who can take away her healthcare coverage because she has a pre-existing condition. This case touches nearly every one of us. It touches all of our families, and it is so crucially important that in states like Montana, with everything on the line, we elect Democrats who will commit to fight this lawsuit and stop it, standing up for people, not the profits of insurance companies.
Thank you. Let's move over to my home state, over to Greg SCOTUS.
Thanks, Farah. I'm Greg SCOTUS. I'm happy to be the Democratic candidate for Attorney General here in Utah. We have a Republican primary next Tuesday, which will decide who our opponent is. And there's a contested race between the incumbent Sean Reyes and a local county attorney from south of Salt Lake named David Levitt. I'm running for Attorney General in part because of the same reason that my opponent, Sean Reyes, is being contested in his own party. And that is the fact that the Attorney General's office has lost really the respect of the Utah voters, has lost the respect of the Utah bar, and has been held by a number of people, including almost our entire media, as having a for sale sign around their neck. It's been years and years that our Attorney General's office, including the current administration and the two prior Republican Attorneys General, have been beholden to public interest groups, to groups that will donate to their campaigns in an effort, I believe, to avoid their scrutiny, not the least of which was a large energy company here in Utah that donated $51,000 to Attorney General Reyes, notwithstanding that the company was a fraudulent energy company. They were later indicted by the federal government here. 5 of their members are currently in federal prison, and our Utah Attorney General's office turned the other way in response to a $51,000 campaign contribution. I'm also concerned about a couple of things that have happened in Utah over the last several years that have got me even more interested in joining the AG's race, and that is a little bit like what Rafe talked about. But Utah's had 3 ballot initiatives since 2018. Importantly, one of those is what we're talking about today. Utah voters went to the ballot in November of 2018 and passed by a majority, and that was not a Republican or Democratic-led ballot initiative, but they passed by a majority of Utahns, over 53%, to increase Medicaid coverage to Utahns at or below 138% of the federal poverty level. That seems like a pretty easy solution to the Medicaid problem. And in response to that, our Utah legislature has largely ignored it. They passed a substitute bill which really gutted the ballot initiative. And our Attorney General, as Farah indicated at the outset, has joined this national lawsuit, which, if it prevails, would have our Supreme Court declare the Affordable Care Act unconstitutional. That was a terrible decision before the pandemic, and now it's almost inexcusable. One of the things I would do, and people ask what's the first order of business if you get elected Attorney General, is to get us out of that lawsuit. Utah needs an affordable care program. Utah needs expanded Medicaid. The Utah voters have endorsed that, and the Utah legislature has neglected it, and our Attorney General has taken it one step further and is actually fighting to take away health care to Utahns.
I love to hear some clarity through the fog in my home state. So it's really great that you're our nominee in Utah. So let's jump over to Jonathan in Indiana.
It's great to be here and join hopefully my future colleagues on this call to talk about the importance of healthcare and the importance of preserving the Affordable Care Act. It's interesting to hear their stories because, you know, although they're in different parts of the country, really we're all experiencing the same thing with the citizens of our respective states. I'm a former mayor of Evansville and a legislator in the Indiana General Assembly, and most recently was chancellor of a local community college when I decided to run for Attorney General. I got into this race because of the incumbent, frankly. He recently has had his law license suspended for 30 days because of sexual assault committed on 4 women in a bar. He also has led the efforts to find the Affordable Care Act unconstitutional. And those really are the 2 issues that motivated me to get into this race. And as we have seen over the last 3 months or so, events have really overtaken our respective politics in our state, especially with the global pandemic, coronavirus pandemic, and the death of George Floyd. It really has brought to the surface issues that are concerning working families in the state of Indiana. We have folks who are worried about their jobs, they are worried about maintaining their health care, but they're concerned about putting a loved one in a nursing home and they don't know what the facility safety record is. You have folks that have put their life savings into a family business. You have parents sending their kids to school in this fall without really a good feel for, are they going to be safe? Are they going to be in a position to learn? These are the issues that are really at the forefront of the minds of Hoosiers, and I think Americans across this country. And it really is up to us as Democratic candidates for Attorney General to really be there on the front lines and support these families, make sure they have opportunities to succeed. And I really think that starts with preserving the Affordable Care Act.
Great. Thank you, Jonathan. And as you can already tell, we have some really great champions who want to make big changes in their states, flip the states, and give affordable healthcare and access to those who really need it. And so on this topic, so one of the biggest issues facing the country is access to affordable healthcare, like we just said. So the growing concerns around the COVID crisis have made the need for quality healthcare even more important. So why is access, and this is a question for each one of you, so why is access to affordable healthcare so important to your state's response to the coronavirus? So we'll go ahead and start with Rafe on this one.
Well, I think the COVID crisis has really laid bare just how fragile our healthcare system is right now. And in Montana, it's really shown us how many Montanans truly live one paycheck away from healthcare disaster. And in a time of pandemic, it couldn't be worse to have this activist effort to burn down a law that provides healthcare to 1 in 10 Montanans directly and protects nearly half through the protections for pre-existing conditions. I really think there are 3 discrete issues that have come up as a result of COVID that make this case so bad. The first is we know that people with pre-existing conditions are at higher risk for complications as a result of COVID. And if you're going to have a big change in American law that allows insurance companies to exercise more power over those people to potentially deny life-saving care, that's a huge problem. I think the second issue is we know that under COVID, access to normal preventive care is a lot harder. It's harder to get into your doctor's office and receive the kind of health care that keeps you healthy, that keeps those pre-existing conditions from getting worse. To rip health insurance away from those folks or give insurance companies that power is a mistake right now. And I think the third issue is for states like Montana that have expanded Medicaid under the Affordable Care Act, you're talking to about up to 10% of the population just straight up losing their health care if this lawsuit is successful. And with rates going up across the country, including in Montana, I could not think of a worse time to engage in these kinds of political games to score political talking points that expired 10 years ago. This law is here to stay, but for the efforts of Republican attorneys general. My opponent in this race literally said the reason he ran was because the current Republican in Montana wasn't militant enough on this case. His motivating reason for running is he wants to be more aggressive in stopping the Affordable Care Act. That's a choice I'm happy to bring to Montana voters because I think people want someone who will protect their care, not get rid of it.
No, all good points, especially with the high risks that are happening and that this is really becoming a political talking point. So Greg, why don't you tell us kind of what's going on in Utah and why this is so important?
You know, I think this COVID virus has pointed out how ill-prepared we've been both nationally and statewide to deal with something as egregious as what's happening here. But it really shouldn't have taken a pandemic to wake up the country and to wake up the state of Utah to the needs of people in healthcare. My office is not far away from the United States Bankruptcy Court for the District of Utah. And if you walk down there, you'll find that a lot of the people that are filing for relief under the Bankruptcy Act are doing so because of medical bills, hospital coverage, doctor bills that have gotten out of control and that they can't maintain. So who suffers from that? Well, the providers themselves. That's something that could be so easily avoided. We have the opportunity here in Utah to have expanded Medicaid through this voter initiative that I talked about earlier that would equate to a 0.15% sales tax increase. That is 15 cents for every $100 spent by a Utahn in sales tax that provides coverage to 102,000 Utahns. Now, if that wasn't important enough before, just seeing what's happening with this virus and seeing how what's happened to our state, what's happened to our communities, what's happened to our businesses is all the more reason why we need to be on top of this. We need to make sure that we're not doing away with the Affordable Care Act, or if we want to tweak it, let's tweak it. But just to go into the Supreme Court, which the my Republican opponent and 18 others from out the country are doing tomorrow with their opening briefs, and saying, hey, it's an illegal taxation. The federal legislature didn't have the authority to do that. Let's just do away with it is nonsensical, because Utahns, and I think all Americans, are going to say, okay, if you don't like it, what's the alternative? And we just haven't proposed a reasonable alternative, and not here in Utah, and not nationally. This virus has really shot us all in the arm and said, hey, wake up, America. There are some things coming down the road, and this isn't the only healthcare crisis we're going to suffer in our lifetimes. And it's probably not the only one we're going to suffer in the next decade. And how are we going to be ready for the next one when we have such poor planning and really response to this very one? Utah Attorney General and Governor have spent all kinds of money on just these wild cures that they thought they wanted to be on top of the pandemic when it hit, and spent hundreds of thousands of dollars on really what ended up being sort of flim-flam plans because we were so poorly prepared. That's inexcusable, and we also need to be aware that this isn't the last time we're going to be facing this type of crisis.
Thank you. And I know you mentioned the amount of Utahns that are going to be affected by this, which I want to dive into just a little bit, because you did mention 102,000 Utahns, and I know we are looking at different numbers in each state and how that affects everyone. And so turning to you, Jonathan, can you talk to us a little bit about Indiana and what's going on there?
To build on the comments that my future colleagues just mentioned, this is what drives people nuts about politics. This is what drives people away, because what we see are Republican attorney generals simply just following this philosophical bent that they have, that they want to satisfy, without really looking at the practical impacts that overturning the ACA would have on working people, on working families, on Hoosier families. It's just the wrong direction. So, you know, when I think about how the coronavirus has impacted healthcare, some of my colleagues just mentioned what's going on in their states, but when you think about if you don't have healthcare, if you don't have health insurance, it's difficult to get the treatment or have the tests done in order to figure out if you're sick or if you have COVID-19, that would then tell you not to go to work, so you're spreading it to your coworkers. Or those people in low-paying jobs, they can't afford to miss work to go get tested without having the health insurance necessary to pay for the exam or the treatment. It really does, the coronavirus really does underscore the importance of having comprehensive access to affordable health care for all Hoosiers.
Thank you, Jonathan. So I want to actually stick with you, because you've said many times that on day one as AG, you will remove Indiana from the lawsuit. So why is it important that this is your first act as AG?
Well, I think it's incredibly important to be out front and be aggressive in telling people how you are going to protect, how I am going to protect their health care. And there's no better way to communicate that than to draw a line in the sand with regard to Republican efforts to find the Affordable Care Act unconstitutional. This is something that has a real impact on Hoosiers. There are roughly about 2.7 million Hoosiers with some type of pre-existing condition, whether that be diabetes, high blood pressure, even a pregnancy would constitute a pre-existing condition, who will find it difficult or very expensive to find insurance if Curtis Hill is successful. There are roughly about 500,000 Hoosiers who now have health care because of the Medicaid expansion under the Affordable Care Act. This is through the Healthy Indiana program, initially designed by by Republican Governor Mitch Daniels, expanded by then Governor Mike Pence through the Affordable Care Act, and now we have a Republican Attorney General trying to capsize the whole thing. We have 30,000 children who have health insurance as a result of the Affordable Care Act. And, you know, and as I think through this, I can't help but think about a next door neighbor of mine or family that where they had a young person, a young kid with a genetic disease where they were quickly running up and bumping up into the maximum expenditure that was allowed by their insurance. And these are folks who are starting to panic about how are they going to come up with the tens of thousands of dollars on an annual basis to help take care of their son. The Affordable Care Act fixed that and created some great security, at least on healthcare, for many Hoosiers. And we have to do our best to maintain that, especially through this coronavirus pandemic. I think it's unconscionable that Republicans would be talking about and with their efforts to try to take away healthcare from Hoosiers.
Thank you. So great points there. So I want to see kind of what it is in Montana, because Rafe, the current AG of Montana, since he hasn't joined the lawsuit officially for either side, what do you think, or why do you think it's important for the state to be part of the lawsuit and defend the ACA?
So Montana only has about 1 million people in our whole state, and of that, 429,000 have what an insurance company would call a pre-existing condition. So there really virtually isn't a single family in our state that the stakes of this lawsuit don't touch. It affects all of us. As I mentioned earlier in the call, nearly 1 in 10 Montanans get their care directly under expanded Medicaid, which is made possible by the Affordable Care Act. You know, our state took a sort of unique position. Montana, the current Attorney General who's leaving office in his wisdom said essentially, well, the law is unconstitutional, but we shouldn't do anything about it. That's a position that will not survive the 2020 election. We know Montana's going to get involved in a big way in this case. The question is on which side. My Republican opponent has promised that on day one, he'll flip Montana's position to say, burn the whole thing down. Let's get rid of the ACA. Let's take healthcare away from 100,000 Montanans. And let's tell nearly 1 in 2 of our friends and neighbors, an insurance company now gets to decide whether to keep you on the plan or not. On the flip side, I've pledged throughout this campaign, before he even got in, that one of the things that I do as Attorney General on day one is get involved in this lawsuit and advocate to stop it, be part of the Democratic coalition that says this law is here to stay. This law is clearly constitutional, and the successive efforts to undermine it do nothing more than put our health care at risk. There's no productive use to it. The law is the law. So I think the stakes are really high, and again, I think Montanans have time and again chosen that when on the one side you've got political talking points and games, on the other side you have an option to make your life measurably better through the legal system. They've chosen the latter, and I think that's the choice we face in November here.
No, that's so right. And you've mentioned political talking points a few times, actually, all of you who really have. And so lastly, I want to go over to Greg and talk about why AG Reyes is calling the Medicaid expansion. You've talked about this already a little bit, but let's just dive into it a little bit more, is that he's calling it inappropriate. So what would you do as AG, and why do you think it's important for Utahns to defend the ACA?
So what's inappropriate, Farah, is that the Utah voters had to go to a ballot initiative to get the Republican legislature to do something about healthcare. What's inappropriate is that the voters passed that initiative by a majority, and it's still not in effect 2 years later. What's inappropriate is that our Attorney General is part of this lawsuit under a time when our country is at its most exposed in terms of its healthcare. It's most at risk in terms of its healthcare. And you know, both Rafe and Jonathan have mentioned a couple of personal stories, and I have to bring up a couple myself. I talked to a retired judge recently, and she told me that her son suffers from some really debilitating mental problems, but he's an adult, and so he wouldn't necessarily be covered by her coverage that would have been provided by the state as a judge. A federal prosecutor who I know very well told me the same thing about her adult son who was suffering from addiction and other problems. They both relied on the Affordable Care Act to save their sons. They both relied on the fact that they had the resources to take care of that and to save their children. Neither of those, even though they're very prominent lawyers, judge, prosecutor, would have had financial ability to withstand that and take care of their adult children without the Affordable Care Act. So if we have problems with the Affordable Care Act, or we don't like some of the nuances of it, let's find an alternative before we just throw it out the window. Utah's ballot initiative was ignored by the legislature because they said it was underfunded. They said that 0.15% sales tax wasn't going to cut it. Rather than say, let's go to 0.25 or whatever number they wanted, they just changed it altogether. And like I said, our attorney general ignored even them and is part of this lawsuit, which is just deplorable. And I've said it once, I'll say it again. It's something we'll get out of the day I elected attorney general.
No, that's great. And I actually wanted to ask all of you if there was a person on the campaign trail this whole time that has really symbolized why healthcare fight is so important. But you guys have already mentioned those incredible stories. So I want to talk about the voters. And so in your state, for voters in your state who care about meaningful access to healthcare, how can they let their voices be heard? So I want to start with Greg on this one.
So Utah, and I suppose even some of the surrounding states, has been a red state forever. We haven't had a statewide elected Democrat this century. True story, we haven't had a statewide elected Democrat since 1996. But several of the ballot initiatives, including the one we're talking about today, affordable health care, are really Democratic issues. They're really Democratic programs. And the voters pass those. They pass those by a majority. But then we elect Republican legislators and a Republican attorney general who ignore that. It just seems to me that we Democrats need to get the message out that these are Democratic issues. These are issues that affect everyone in the country. They affect everyone in our state, but they're not supported by the Republicans. And if we want to have affordable health care, if you want to have your neighbor, your friend, your loved one, your son covered, even in a time when it's very difficult for you to get coverage on your own, we need to have a plan in place to do that. I think this year is such an opportunity for Democrats. It's such an opportunity for Democrats here in Utah and nationwide. Our administration from the very top in this country has just been a failure on this and other issues. Our administration in Utah has been a failure on this and other issues. And the voters have spoken. So I somehow, and I don't know how to do this, but we need to get the message across to voters when November comes that these issues, if they're important, and they clearly are, at least to the voters in Utah, need to be supported by candidates who will support the will of the people. And if there's an elected official in any state that's supposed to represent the will of the people, it's the state attorney general. I mean, that's your calling. If the people want something, let's figure out a way to get it done. They're your clients.
Very, very true. I think the people deserve more than just lip service. So, Jonathan, why don't we hear from you about how their voices can be heard?
Well, ultimately, their voices can be heard at the ballot box. That's the most important way that people can show their support or displeasure for the respective policies put forth by the candidates for attorney general and for every office up and down the ballot. When I look at what's going on in this political environment, and I think about the issues important to Hoosiers, I'm not sure they're so interested in who's the Democrat and who's the Republican. I think they're looking for leadership. And they're looking for leadership that's going to help them deal with the challenges that they face, which have all been magnified with the coronavirus pandemic. In Indiana, we have roughly about 13% unemployment. Folks are concerned about their health insurance. They're concerned about nursing home care. They're concerned about their schools. They're concerned about their their small business. These are things that I'm not sure that they're going to care about. We got to vote for Republicans for this reason or Democrats. They're looking for leadership. And there's no better way for us to provide that leadership than to take a strong stance in opposition to what Republican attorney generals are trying to do and dismantle the Affordable Care Act. We can help protect Hoosiers' health care, which will have a big impact on their ability to provide for their families, on their ability to deal with the coronavirus as it affects them and their communities.
No, you're so right. This really is a personal issue, and taking politics aside from it, we're really talking about healthcare and people's lives on the line, especially during this time. So, Rafe, what about you? What do you think?
I couldn't agree more, and I really think of this as an economic issue, a jobs issue. I mean, think about what's really at stake, what really the core of this lawsuit could mean for Montanans who are affected by it. It means that if successful, a private for-profit insurance company can exercise more power over your life, more power over whether or not your health care makes sense in their financial plans. Well, Americans decisively rejected that view of insurance 10 years ago when the Affordable Care Act passed in the first place. And the courts have decisively rejected each of the successive challenges since then. And, Montana's a state where we elect Democrats, we elect Republicans. And, I think as Josh was mentioning, Montana's a state where folks look for leadership, and they look for someone that they can trust and that's really looking out for them and fighting for them. And I think the contrast in our race could not be more clear. You've got someone who is chomping at the bit to go join a national flashy lawsuit that might be popular on certain cable news channels. And you've got as an alternative a candidate who's focused on ways to make your life better, ways to use the immense power and creativity of the Attorney General's office to improve your standing in the world. And I think that's a choice that historically has attracted Montanans to vote for Democrats in our race. I think the choice couldn't be clearer in our state. And I'll end with this. What can people do? Well, you can vote, you can volunteer, and I would really make a pitch for getting involved in the Attorney General's race. Part of what makes this office so special and so different is that AGs can think big and they can fight big, and they don't need permission from Congress or lobbyists to do things. And that really highlights the stakes of an election like ours. On one hand, you can have Democratic AGs like AG Tom, who's leading a nationwide effort to lower healthcare prices by fighting prescription drug monopolies. That makes your life better. On the other side, you have Ken Paxton and this Republican, what I've called arson, attempt to burn down the Affordable Care Act. Both are examples of AGs fighting big, and I think in each of our states, voters face a real choice about which direction to take this office.
So you mentioned how can voters voices be heard? However, how can they get involved in your campaign, Rafe?
The best way to get involved in our campaign is to get on our Facebook page and like it. It's just search Rafe Grable for AG, or it's facebook.com/Rafe for AG. You can send us a message. You can share our content, including about today. We are so lucky in Montana that we still live in a small state where person-to-person relationships matter and where individual conversations matter. I think that's why we have all these ticket splitters in Montana. So the first place to go is facebook.com/Rafe for AG. And get involved with our campaign, follow what we're up to, get our latest updates. And we're going to be out there all summer, all fall, talking to voters, making direct contact, because when we run on these kinds of issues about making your life better and preventing disasters like this lawsuit, I think Democrats win in each of our 3 states.
And I appreciate that, growing up in a small town, so I love to hear it. What about you, Jonathan? How can voters really get involved in your campaign?
I think as much as anything, it's important for people to get engaged. They have to get engaged in the political process. I would encourage them to get engaged in this race. We've talked about the importance that attorney generals throughout this country can play in protecting folks' health care. That's been the subject of this call. But there are a lot of bread and butter issues that we can play a significant role in our respective states to really make a difference in people's lives. And so getting engaged means, of course, voting, but it means making a financial contribution to our campaigns. It means participating in social media, forwarding information that we put out there to post so that it gets to their friends and neighbors, having those one-on-one conversations out in your communities and your neighborhoods about the importance of this race and the importance of electing a Democratic Attorney General in the state of Indiana. All these are really solid ways that folks can make a difference and they can take ownership of their future. We don't have to sit back and just let a Republican Attorney General kind of run roughshod over people's health care. In this case, we can vote. We can take action. You can take your future into your own hands and provide a better future for your own family. And you do that by getting engaged in these campaigns.
I love that. And more importantly, I love the hard ask that you made, Jonathan. Over to you, Greg. How can people get involved in the Utah AG race?
You know, I've learned so much in this race since we jumped in February, which coincidentally was about the time the pandemic hit. I attend court hearings every day, exactly like we're doing this meeting now. I had court this morning that was just on a video. I would have never thought me, having practiced law for 30 some years, would be so adept at the internet. And I'm not saying that I am, but I've never had a Facebook page until now. I've never had a Twitter account, period, until now. I've never known what Instagram is or how it works until now. But I'm very motivated by the young people that are supporting our campaign. I love the fact that we have those various social medias that are helping us out here, and the best way to get involved is just to go on social media, to go on our Facebook page, SCOTUS for AG, to go look at our Twitter account and just see what we're saying, listen to what we're saying, and listen to what our opponent is saying, and decide for yourself. And affordable health care is only one issue. We have so many issues here in Utah that our Attorney General has just been a failure on. Let's look at those issues and say, okay, here's his position and here's mine. Which one is more in line with your values, whether you're a Democrat or an independent or Republican? And there's so much to learn right now, and hopefully with a lot of things that we're seeing in this country, that there's a silver lining to it. Hopefully what we're seeing with respect to police reform, with respect to Black Lives Matter, with respect to healthcare that we're talking about today, that people will just wake up and say, look, if this is the way we want our country to look 4 or 8 years from now, then stay the course. But Democrats have so much to offer and so much change to bring to the table. So many good ideas that are mainstream, that are consistent with what the majority of people want. And we can work together with groups. We can work together with agencies. We can work together. We can peacefully march. We can have healthcare for everyone. There's no reason why we can't do that, except for the divisiveness that's happened in our country. And people just need to get involved this year, more than ever in my lifetime.
That's really great. And now I do want to ask you one final question before we wrap up here is I'm going to give you 60 seconds each. All right, 60 seconds. And I want to hear a final thought that you want viewers and voters to hear about you or your race and why this is important. So let's go ahead and start with Jonathan.
Oh, you're going to put me on the spot first, Farrah. I'll have a little bit of time to think about through this question. You know, frankly, the bottom line is it's about individuals. It's about the people you elect. And frankly, I have a track record and of experience of being able to work across the aisle to get things done, whether that's as mayor of the city of Evansville or chancellor of the Evansville campus for Ivy Tech Community College. In that chief executive position, I have to listen to people from all different perspectives, seek input from folks, try to build consensus, and then get stuff done, and every day being held accountable. I think that type of experience, that type of political savvy is really what the state of Indiana needs with their next attorney general. Someone who's going to reach across the aisle, who's going to work with Republicans and Democrats, someone who's going to pay real attention to the needs of Hoosier families so that we can create a better future, a brighter future, a more just future for everyone in the state of Indiana.
Love it. Excuse me. Rafe, your 60 seconds.
Sorry, lost you for a second there. Out on the frontier, we have some internet issues here. You know, I think this race is incredibly important, and it's a real chance to think about what role the legal system should play in people's lives in Montana. We've talked throughout this campaign about the various ways, some stealthy, some overt, that the legal system's really been turned against regular working people in our state and throughout our country. I think this lawsuit is a perfect example of how people are trying to use legal tactics to try to invent ways to do away with something that makes people's lives better. And I think the choice we face in Montana in 2020 is, are we going to elect an attorney general who's part of those games, who's part of signing on to these national lawsuits that try to tear people down? Or is the attorney general's office a place of empowerment, a place to give meaning and voice to the rights and protections that we have in our laws now? That's a choice that people have historically entrusted Democrats, and they make it. I think this office, the stakes couldn't be higher in 2020, and I'm so excited about the work you're doing at DAGA, the work that other candidates are doing, because these are issues common to all of us. This lawsuit puts our healthcare at stake across the country, and I'm so excited to see other candidates out there running on the same issues, because ultimately I think these are the issues that voters care about and will trust Democrats with in November.
Thank you, Rafe. And then Greg, let's hear it for you.
So I haven't had a chance really to talk about myself and my experience, but I'll do that in 60 seconds. I started my career at the Salt Lake Legal Defenders Association as a public defender, went to the Salt Lake District Attorney's Office and prosecuted there for 8 years. I was Utah's first gang prosecutor. I was the head of the Sex Crimes and Special Victims Unit there for several years. I brought the drug court concept to Utah courts back in 1995. We'd never had that. Worked with the Salt Lake Area Gang Project in enacting new legislation. I've practiced law in every county in Utah. I've conducted jury trials in every district court in Utah. I bring that experience to the table, and I'm the only candidate for Attorney General that can say that. I'm the only candidate for Attorney General that has reached out and has met with and has sat across the aisle with almost all of the current elected county attorneys in this state. And I've reached out to all of them in the last couple of weeks and just told them, we're here to support you. Whether you're Republican or Democrat, we're here to support you, and the Attorney General's office will work with you and not come into your county and try to tell you how to do your job, which is what's unfortunately been happening. We intend to clean up that office and make sure that people are not coming into that office with large campaign contributions to make sure that the Attorney General looks the other way. That's not going to happen. That's just won't happen under our administration. We intend to run an honest office. We intend to run it fair. We intend to represent the people of the state of Utah. We intend to support their wishes, their ballot initiatives, and what they want to do. We intend to stand up to the Republican legislature and say, look, the people have spoken on several issues. Let's figure out how to get that done. Let's sit across the aisle and work together instead of all working toward one goal that isn't consistent with what the people want. This is an opportunity for Democrats, I think, nationwide to take a huge step. And if we don't take that step, I think we only have ourselves to blame. But we're raising money. We're working hard. I'm still trying to practice law and run a campaign at the same time. But I've enjoyed every minute of it. And we are here for the long haul. And we will be there on Election Day in November, standing tall.
Well, thank you so much. I think we've all heard some really great reasons as to why we need to flip these states and giving the power back to the voters by making the change and putting they just deserve so much more than what they're being given right now with the current with how things are currently going right now. So I do want to thank our candidates. I want to thank everybody who's been joining us today. And please don't forget to follow us at Democratic AGs. And please follow all of our candidates here on their Twitter handles and their social. And please donate to stay up to date with our candidates, but also to stay up to date with DAGA and with the Dem AGs and these 2020 candidates. So thank you, everybody.